Hi, my name is Lillian Timchak, and this is my presentation on the critical role of the nurse researcher. A nurse researcher is generally an advanced practice nurse with either a master's degree or a PhD. They conduct research using the guiding nursing theories. Some research topics include infection control, community health, nursing interventions and their efficacy, social determinants of health, and healthcare delivery. They serve every population as they study population health on macro and micro levels. They study nurses as a population in themselves, looking at practice, standards, burnout. They study specific patient populations, such as underserved populations, specific hospital populations, chronic illness populations, prevalent geriatric population, and the underinsured population. Nurse research really started with Florence Nightingale, even though she may have not known it at the time. She used statistical analysis and made evidence-based practice changes and created a healthcare reform. In the 50s and 60s, this is when the development of nursing theory and nursing as a science came into play. In 1970, Archie Cochrane was known for his randomized control trials. And in 1992, David Sackett became known for evidence-based medicine. He was a big supporter in a time when it was looked down upon, and he said it's the conscientious, explicit, and judicious use of current best evidence in making decisions about the care of individual patients. Back at this time, medicine and science were considered more separate, and holistic medicine was not as popular. Where we are now is trying to implement an introduction into nursing research earlier in nursing education. We've seen that in our own education here at UAA, and it has had success nationally. We are working on defining collective nursing research goals to help guide our practice. We require further theory development. Theory development can also include mid-range theories. These can be situation specific or have to do with certain patient populations and stem from research and assessments. Generally, on the national level, the National Institute of Nursing Research said in 2016 that they were focusing their research on symptom science and development of personalized strategies, promoting health and preventing illness, improving self-management strategies for people with chronic illness, and end-of-life palliative care. Internationally, between 5 different countries, including the United States, they found that the goals were focusing study on implementation science, data science, training of future nurse researchers, population health, and team science. All of these goals and topics stem from previous assessment data and dealing with the struggles of our current population demands. Specifically in Alaska, the National Alaska Native American Indian Nurses Association has identified indigenous health disparities, including social disparities, higher prevalence of chronic illness, lower life expectancy. Specifically pertaining to clinical nursing, are health com disparities, disparity in the diversity of providers, and the promotion of culturally competent care. Some of the interventions that they've come up with is an increase in outreach activities to improve collaboration between the National Institute of Nursing Research and the National Alaska Native American Indian Nurses Association, as well as tribal colleges. and also to facilitate Indigenous nurse recruitment. Another intervention is to ensure culturally competent research using tribal institutional review boards. Promising prevention here in Alaska. The National American Indian and Alaska Native Prevention Technology Transfer Center has many interventions on their website. Specific local prevention programs. The public health nurses in Manilac, the Northwest Arctic Borough, and Point Hope region have interventions based on their population assessment. They are performing immunizations, well child exams, health screening, counseling, and school screening and outreach, where they're coming to the schools and teaching education. One of the interventions for this population specifically was teaching about safe relationships, as they have high rates in domestic abuse. The nursing researcher's role in prevention is huge. We nurse researchers are who are coming up with evidence-based practice. They study intervention implementation, which helps facilitate change. They conduct health assessments to help prioritize the needs of populations. And they also provide current research to help guide nursing education. I hope you liked my presentation. These are my resources that I used.